As we're learning to live with life within a pandemic, one of the most commonly asked questions has to do with testing. When should a person make the decision to get the test for COVID-19?
That's a great question. The County of Santa Barbara asks for those who are at a low or no risk and who want to get tested to avoid or defer testing at this time, leaving the capacity of testing for those who need to get tested. So how do you know if you need to get tested? Well, if you work in a high-risk environment with frequent interaction with the public and members from outside of your household. Do you work or live in a high-density or group setting like a skilled nursing facility? Has a healthcare provider advised you to get tested? Are you an essential worker, a utility worker, or a grocery store worker, or a public service worker? Have you had a close contact with somebody who's had COVID-19? What's a close contact? Prolonged interaction of 15 minutes or more within 6 feet with a COVID-positive individual and no party wearing a mask. Lastly, do you have symptoms of COVID-19? If you can answer yes to any one of those questions, the Public Health Department would recommend that you get tested.
And if a person decides that they would like to get tested, where should they go?
There are a number of options to get tested. Your healthcare provider, urgent cares, community clinics, and even some pharmacies offer testing. If you don't have access to healthcare, we recommend you visit the Public Health website to see if you're eligible for healthcare through one of our community health centers. Lastly, a piece of the testing puzzle is our community testing sites located in Santa Maria, Santa Barbara, and Buellton. As a reminder, those sites are by appointment only, and if for whatever reason you cannot make that appointment or simply decide not to go, we encourage you and highly recommend that you cancel that appointment to allow space for others who need to get tested that opportunity.
And if a person decides that they are at risk and should get a test, but they can't get an appointment, what should they do?
So first and foremost, we encourage folks who aren't feeling well and are experiencing symptoms of COVID-19 to contact their healthcare provider for immediate guidance. Again, if they don't have access to healthcare, we encourage you to visit our public health website to see if you're eligible for healthcare at one of our community healthcare centers. Last but not least, if you don't have any immediate healthcare needs and you simply just don't feel well, the best solution is to stay home and care for yourself. The best thing you can do to stop the spread of COVID-19 and to feel better is to stay home. Stay home from work, stay home from physical gatherings, and recuperate and get feeling better.